One of the issues we get so many questions about menopause and all the things that are attached to menopause and related to menopause. Today, we are so excited to have a returning guest, OBGYN Dr. Ardelle Piper, here to answer your questions. Let's dive in. Welcome to the Girls Talk Healthy Aging podcast, where we dive deep into pressing health and fitness issues facing aging women. I'm Alli Kerr.
And I'm Shawna Kaminski. And together we'll bring candid conversations, expert advice, and personal stories that will inspire and empower you on your own wellness journey. Last time we talked a lot about, the difference between bioidentical hormones, synthetic hormones, and in some locations, women, they've gone to their doctors do nothing. And they end up at some spa, someplace, or, chiropractor or naturopath or wherever that wants to give them bioidenticals. So Is it better to just not take anything or take the bioidenticals? A lot of women's hands are tied right now and they just are desperate.
Yeah. And again, I think this points to the confusion between bioidenticals and compounding. Right. So when I read that question that you sent, because again, this comes up every single day I have a clinic, absolutely every day. There's someone who's confused between this. Compounding is a process of making a medication. There are lots of medications out there that don't have bioidentical hormones in them. Right. Compounding is something that is a good tool that we have for making medications that are otherwise not available through government regulated products. But they then by nature don't have the same amount of safety and research behind them because they are, mixed up every single time, right? You can do a study on a medication if it is going to be produced the same way, and you can randomize, people to be using it and seeing how they respond if they have a certain condition, etc. So compounding by nature is then very difficult to study in that way, right? And so a lot of people have sort of conflated the concept of bioidentical with compounding because compounders tend to advertise that they make a hormone therapy that has bioidentical ingredients. Okay. So first clarification then about that question. Is it better to get compounded hormone therapy than none at all? I would say no, because compounded hormone therapy then doesn't have that same regulation behind it. It doesn't have recalls. You don't know if you're going to be absorbing it more or less than what they expect. That's one of the reasons why there's often a lot of blood testing that is involved with compounded therapies, is because they're trying to see how much you're actually getting in your bloodstream because it's a little less predictable. There are people who have then, bad outcomes. I've had people who come to me when they've been on compounded estrogen and particularly testosterone, and their levels are way out of normal range, right? And so the compounding process itself shouldn't be demonized, but compounded hormone therapy for menopause, for the most part, is not necessary. Right? It is a workaround. You're exactly right. And that people end up going to compounders to get hormone therapy because they seem to have less qualms about the safety and the benefits and the risks. And compounder products, because they're not regulated from Health Canada, don't have to have that big insert of warnings on them. They're not regulated to, right? Because the ingredients of them are different. There isn't a universal handout that you can have inside a compounded therapy when the ingredients are different every single time. And so it ends up giving an illusion that those things are safer because they don't have warnings on them. I had a woman who came to me once. She was referred to me because she had been on compounded therapy, and now she was, I think she was getting close to 70. And we'd had a good discussion, and she kind of then realized that she did have benefits of being on hormone therapy. She thankfully hadn't had any negative outcomes. Part of it was because her uterus had been removed. And so bleeding and uterine cancer, that's one of the big things that we worry about with compounded hormone therapy is, are you getting the right amount of progesterone to protect your uterus? Are you getting excessive doses of estrogen? And so now you are at risk of endometrial hyperplasia and cancer. That's a problem with compounding, right? She didn't have that problem because she didn't have a uterus. And so when I moved her over to a transdermal, very low dose estrogen therapy, she felt pretty much the same, but she actually called me up in a panic in a couple of weeks because she was like, I read this insert about all the risks of hormone therapy. She's like, well, I didn't have these risks with my compounded therapy. And I'm like, yeah, you did. But they just weren't declared, And so this ends up being part of the problem with compounding, is that it's really not well understood, and people who choose compounding don't have the same risk benefit conversation with that practitioner often. And the other benefit of using Health Canada approved products is that you can go to any pharmacy. You can switch between a Shoppers and a Rexall and a Costco. You can move from one province to the other. You can have one family doctor retire and the next one take it over. They all know exactly what that medication is. And so it is much more reproducible, much more trustworthy over time if you're going to be on hormone therapy for a long period of time, that you can use a product that is reliable and is going to be the same. So those are all the benefits of making sure that you're using government regulated hormone therapies that, yes, can be bioidentical. All the gels are all the patches and gels that you absorb through your skin, they all have bioidentical estrogen in them. And micronized progesterone, the brand name is Prometrium, but there are 5 different generics of micronized progesterone. Even if your coverage plan doesn't want to cover the brand name, those are all, if they say micronized progesterone, that's bioidentical. If your box of patches or your gel says 17 beta estradiol, that's bioidentical.
So my bad in that question is I should have said compounded hormones instead of bioidentical.
No, but you're exactly right though. That's what women will say. That's how women ask that question.
Yeah. So that is just so confusing. And the other thing that my understanding that I need to be clarified is that my understanding is that getting blood tests for hormone levels is not an accurate way to test your hormones because they fluctuate so much, not only monthly, but daily. Is that correct?
Yeah. So when you're in perimenopause and you're starting to feel horrible symptoms, your PMS is worse, your periods are heavy, and you go to your doctor and I'm like, this has to be hormonal. I want my hormones tested because I'm out of balance. 2 scenarios here. Okay. One is that you get your hormones tested, and that month your ovaries made sufficient amounts of estrogen and progesterone. And so that you'll get a lab result that comes back. And even though your PMS was horrible because your estrogen was higher than what you're used to, it comes back in the normal range. And so then your doctor says to you, no, it must not be perimenopause because your levels are normal. That's a moment in time of what your estrogen level was. And of course it's falling in normal because you're still menstruating, right? The range of normal is huge. And so in perimenopause, if you have a day that your labs are done where your estrogen is being produced by your ovaries, it'll come back in normal range. Well, what about next month? Next month, your hormone levels might be very low, right? What if you're in late perimenopause and now every once in a while you're skipping a cycle? Well, then you could have a lab result come back and show that your FSH is high and your estradiol from your ovaries is low. And then what? It's tempting to say, oh, well, this looks like you're in menopause because your estradiol level is hardly measurable. But then next month you have a period again. Right? So perimenopause by definition is flipping back and forth between you making high levels and low levels. And so the lab values don't help at all in perimenopause. It's your pattern of symptoms and your age and your cycles. And that's what tells us that you are in perimenopause. It's not the lab value. Once you are in menopause, I get this question all the time. I'm in menopause. I've been on my hormone therapy. I'd like to have my levels checked to just see if if I'm right. Your symptoms tell us that you are getting the right dose, right? Because if you take every single menopausal woman, if they're not on hormone therapy, those who have symptoms will have an estradiol level that is under 30 or undetectable. Those who do not have symptoms of hot flushes and night sweats will have an estradiol level that's under 30 and undetectable, right? Mm-hmm. And when you put people onto menopausal therapy, some people have their hot flushes and night sweats go away with 1 pump, or 1 small sachet of gel, or the lowest dose of patch, or the lowest dose of oral tablet. Other people, that doesn't make a difference. They have to go up to the next dose, and then the next dose, and the next dose. So the dose that treats your symptoms is the dose that you need to treat your menopausal symptoms. And so that isn't measured necessarily in someone's bloodstream to say, oh, as soon as we hit 50, 100, 200. Again, we have general sort of concepts that, if I have someone where I'm giving them what is, medium to high levels of hormone therapy and they're not responding, of course, I'm going to check their blood and go, is this getting into your bloodstream? Let's get you to take your gel and then let's measure your blood that afternoon. Or if you're using the patch, you put on your patch on Monday, go for your blood work on Tuesday. Let's see if there's anything in your bloodstream that's registering. That's where testing your estrogen level can be helpful, but it's not helpful from a diagnostic perspective.
So those places, like I have people that come to me that are, they are just convinced that, hey, I see a practitioner, they test my blood every month. Is that a little bit of a money grab? And they're spending money that is unnecessary on tests that aren't really giving the information that they're saying that they're giving.
Yeah. Like if you have an unstable thyroid that they're struggling to get on top of, fine. We do have lab ranges of what your TSH, your thyroid stimulating hormone, should be. We have ranges as to what your free T3 and T4 should be. So, and same thing with, diabetes, the insulin, we have things that have a range that is within normal when it comes to other hormonal systems in your body. Okay. And so in those scenarios, some people might need to be going for labs a bit more regularity to see if they're getting, their TSH in the right target. When it comes to menopausal hormone therapy, though, no. And often when people are going to say someone who's not a physician, who's kind of a part of the provincial program, again, this is where we're talking in a Canadian context, I can send someone for labs, and most labs will be covered by the provincial system because the province recognizes me as a practitioner who's been trained and is licensed and hopefully knows what I'm doing, right? And so most of the labs that I order for people are covered. But if you go to someone who's not that same type of regulated practitioner, like a naturopath, and they're giving you compounded menopausal hormone therapy, and they're sending you with a lab requisition every single month to see if you're getting into the right levels, you have to pay for those labs, because they are not recognized that what they want to do with your health is through the same licensing and sort of acceptance of standards of practice. And so that's why those people are then paying for basic labs that if their family doctor ordered those labs, they wouldn't have to pay for. And so then sometimes those people are being told by that practitioner, tell your family doctor that you need to be on this and you need to get this test. And then that all ends up being really frustrating because it's like, look, why are you giving evidence out of your training? And this is where it would be nice if we could have a better multidisciplinary approach, right? Where the family practice teams, where they have nurse practitioners or physician assistants working with them, under them, so that they are all following evidence-based practice and they have access to specialists, endocrinologists, someone like me, where we can have better communication across different lines. I love hearing from the pelvic floor physiotherapist what they found with that person's, pelvic floor hypertonicity. There isn't a process right now for me to hear from you guys what you're finding with someone's, nutrition or exercise plan and how much they're, progressing, or for me to communicate with you and let you know, what I'm finding. That would be the ideal, is that, we can make sure that we're communicating across lines like that. But right now, I digress a little bit here. Right now, when people are going to an isolated practitioner like a naturopath and they're being sent for all these labs, they're paying for them out of their pocket. And it's because they're not quite, it's not quite part of the sort of multifaceted team approach.
And I think that happens in the United States a lot.
More so. I think so too. Yeah.
More so. So my point is, I wanted to point out a red flag to women that are going and paying for monthly or frequent blood testing, just to have a second thought about it. And I just wanted that to be a red flag, and for them to do a little bit more research and advocacy for their own health.
Yeah. Yeah. Because here's the truth about compounding. They do have active ingredients in them, right? The compounding is not placebo. Compounding can have ingredients that will get into your bloodstream and into your body. And so it's really important that those are the right levels, that your pharmacist knows what you're on, because there can be interactions with other things. Part of the problem with compounding is that people are doing it on their own, kind of over here, and keeping it secret as well from their other practitioners. And so that also creates a very unsafe scenario when your other healthcare practitioners don't know what you're doing over here in your compounding, right? And that ends up being a big problem with that too.
Alli, I think you had something to say.
I know that we got a lot of questions that were kind of specific from people, because we asked them, we said, give us your questions and we're going to ask Dr. Piper. And so and I'll just kind of throw some out there, and then maybe we can kind of talk about one of them. So some folks asked about like cholesterol, do hormones affect your cholesterol? Some folks asked about hair loss. Do hormones affect your hair loss? Or if you lose your hair, can you get it back if you're on hormone therapy? Can you use birth control when you're still having irregular periods and perimenopause? and so all these kind of specific questions. So let's just we'll take one like the hair one. That's a common one.
Right.
Like what
Yeah.
happens with our hair? And so Dr. Piper, tell us, how would you, because how would you answer some of these specific questions? Like, does menopause cause hair loss or will it come back?
Right. So often things like, dermatologic things when it comes to like our skin, our hair, are usually very multifactorial, right? And if you talk to dermatology specialists, they will tell you that a lot of skin aging, a lot of hair changes with time have to do with your genetics. And then a lot of it has to do with your, things that are impacting on those skin or on those surfaces. So, are you wearing sunscreen when it comes to, your skin? That is a huge factor in how your skin ages and wrinkles and age spots and whatever, right? When it comes to your hair, your diet, your stress, other medications that you're on, people who are constantly abusing their hair. Like the truth is, hair dye and a lot of, styling and, people who are pulling their hair back, really tight, of course, then you're more likely like pulling it out of its follicles and such, right? Like there's a lot of things that we do on a day-to-day basis in the name of beauty that are affecting our skin and our hair. So then when you also hit menopause, do we know that there are estrogen receptors in deeper layers of your skin? Yes. That estrogen and progesterone receptors affect your hair growth. Yeah. A good example of that is a lot of people when they're pregnant will actually lose less hair during that 9 month time. A lot of that is because of the progesterone and the higher levels of hormones that actually hold on to your hair longer in what it's called its telophase. So you don't have just kind of the same kind of turnover of just how many hairs you lose sort of all the time when you wash your hair. And, they're all kind of then slowly growing in again from those follicles. If you hold on to a lot of the hair that you would have lost over that 9 month period, then by the time you get to that end of that 9 months, wow, your hair feels really lustrous. And how many women in the postpartum period will report that then their hair just comes out in clumps, right? Well, they are losing the hair that was being held on to over those months. And then they can have, like grow out patterns and stuff like that. So does your hair growth, is it affected by hormones? Yeah. But the trick is how many of those other multifactorial things are playing a bigger part of that picture. If you have like 10 other things that are affecting also your hair loss pattern, including just plain your genetics and age, and then we don't have a whole lot of evidence yet to say who is it that should go on to hormone therapy, how much, should it be your systemic hormone therapy? Should it be that at some point someone creates a topical therapy, to help with your hair growth? Like these are very good questions because we know estrogen receptors are everywhere, but it isn't a simple answer to say, yes, hormone therapy will fix this, and it'll fix this, and it'll fix this, and it'll fix this. The North American Menopause Society, actually, in the last guidelines that they put out in 2022, they have a section about like all the different body systems and where the estrogen receptors are and the changes that you can see that you go through menopause. But you'll notice though that when it comes to their indications for hormone therapy, a lot of those things aren't included in there. And again, it's one of these, we're in this gray zone of appreciating that hormones affect a lot of different body systems, but we don't know if our current formulations of hormone therapy, they haven't been tested with those outcomes so that we can tell people how much, how long, and who it's going to help. And so these are going to be things that change with time. That's just kind of that ends up being sort of the answer to a lot of these, is XYZ being caused by my menopause, right?
Got it. Learn.
Yeah, it's that. Thank you for that answer, because I think for a lot of the questions, that is the answer. Is it depends. We don't know. You need to talk to your own doctor. You need to balance, whether that symptom is worthy of trying hormone therapy or addressing other aspects of health. So I think that I think that a big take-home message is finding a good practitioner. So
yeah. And keep your eye on the research, right? Like I love following particularly the cognitive ones, because this is now a really big question. This question comes up all the time. And I think it was also on your list, does menopause cause dementia, right? Am I going to, well, again, we know that dementia is something that happens with age. We know that some people, particularly if they have different alleles like the ApoE4 gene, will increase risk, right? But all of the things that you can do to be healthy and well and protect your heart, your bones, your breasts are also going to protect your brain. So exercise, nutrition, looking at the stressors in your life, not drinking, not smoking. If menopausal hormone therapy at this point will be shown in the next number of years to help with dementia, it's probably going to be, again, in the highly symptomatic people that should be on hormone therapy anyways, because sleep deprivation that doesn't let your brain do its normal function is a risk for dementia and different cognitive problems that happen with time. So again, if you are a person who's going through menopause and doesn't have hot flushes and night sweats, and you're sleeping well and you're eating well and you've got good health and exercise, we don't have evidence for primary prevention saying just because we know we have estrogen receptors in your brain, and just because we know these things are affected and people can get brain fog and such as they're going through the transition, we don't know. And how are we going to make the right study to actually show and say, should all people consider menopausal hormone therapy to reduce their risk of dementia? I don't know if that study is ever going to be made, right? But it will probably be more clear, how important it is. And it is more clear already that if you have hot flushes and vasomotor symptoms, these night sweats that we talked about, if you do not treat those, then that does confer a risk to your heart. It does confer a risk to your cognitive function, for your ability, to work, to do. So we have to look and say, of the people who are having symptoms, we have had evidence to say we should treat them. So sometimes we're kind of arguing around all these little different points that really have to do about primary prevention. And we're missing the bread and butter conversation of saying, you have symptoms, we should treat them.
Right.
Period. Right. Yeah. Probably 80% of women have temperature dysregulation symptoms of menopause. So just treat them. Right. And the rest of it will come out in research, with time. Right.
Time. Yeah. Yeah. If you had a wish for our listeners, Ardelle, what would it be? Last time it was topical hormone therapy.
Mm-hmm.
The accessibility and knowledge of, the benefits of that.
Yep. Yep. Well, okay. Well, then my wish today, what's the next most common thing that I'm always talking about with my patients? I guess the other wish I would have for people is that they would appreciate, their body and things that they can do to, and this is not only perimenopause, but also menopause. Appreciating your body and things that you can do in your lifestyle that are under your control that can drastically change how we age and our outcomes, right? This isn't to say that strength training is going to get rid of your hot flushes and night sweats, but strength training, building muscle mass, having good nutrition, having good mental health, these things take people so far. And these are things that I'm starting to talk about more in my in talks when people want me to talk to younger people who are in their 30s and 40s. And now they're scared about menopause because they're hearing that it's coming. And they're saying, well, what can I do in my life now to reduce the chance that I'm going to have a hard time later? And it is about health and resilience, right? So much of that is in our control. And that ends up being one of the main reasons why we should offer people menopausal hormone therapy when they need it, is so that they can then continue on being healthy and resilient and doing those activities. It will not make up for poor nutrition, inactivity, like all those other things, drinking too much alcohol, smoking. Menopausal hormone therapy is not a panacea that will fix those things. It is something that is a tool that can be used alongside. Yes. So I guess my big wish then, would be that people would appreciate, their body, their structure, their muscle mass, and access the people who can help them with that. Trainers, pelvic floor physiotherapists, dietitians or nutritionists, look at those really big things that are, big time money that you take to the bank when it comes to your resilience and how you're going to age and how you're going to not only move through your menopause, but how you're going to have a really good life after it as well, because that's going to be half of our life is after menopause.
Correct. And I think it's just such good news that so much is within our own, ability to care for ourselves just by, proper eating and sleep and movement. So my wish is that women will look at the simple habits that we do every day to improve their health. And especially those women that are struggling with, a doctor or finding medical practitioners that can address the hormone aspect of it. They can take control of simple things like nutrition and, with their health that can get them a long way, and the hormones can get them a little bit further.
Mm-hmm. And it's a combination of consistency, right? It matters what you're doing in the long run, but it's also a matter of like progression. So start where you are right now and realize that once you achieve that goal, you've got a next one, right? If you try to jump too far ahead, then people get discouraged or they get injured or whatever, and that doesn't work. And adaptability, right? If you end up having a severe injury or something that happens in your life that takes you offline, just realize, be kind to yourself and come back and find that consistency again, or change the plan when you come back, right? So it's this kind of like dynamic moving ball of, I guess, these three concepts of consistency, of progression, and of adaptability, right? So that at any given time, you're going to be actioning one of those concepts. And if you can sort of have that sort of perspective, then I think people will, again, feel less discouraged in the long run and feel more empowered to do something with where they are right now.
Yeah. Do you have a wish, Alli?
Well, I want to encourage folks to check out part 1 and part 2 of the interviews that we did with Dr. Piper, because we also have resources that she gave us before. So if you want to read more, if you want to learn more, if you want to find out how do I get more answers to my questions and know more about this, then check out those episodes. In the show notes, we have those resources, books, links for you to access.
Knowledge is power.
Thanks for listening. You'll find me, Alli, on Instagram at Alli Kerr Fitness.
And you'll find me, Shawna, on Instagram at Shawna Kaminski. Feel free to pop us a DM with questions and or feedback.
If you're enjoying the Girls Talk Healthy Aging podcast, please subscribe and share it with other health-minded women. Ratings and reviews are also much appreciated and help us get our message out to a larger audience.
Until next time, be healthy and be happy.